twice-weekly Carfilzomib is approved for the treatment of patients with relapsed or refractory multiple myeloma. Now, this is a 30-minute IV infusion, not a great deal of fun, so investigators have been trying to develop a more convenient once-a-week approach, and they have some really interesting news right here at ASCO. To do this, I am talking with Dr. James Berenson, who is an MD, Medical and Scientific Director at the Institute for Myeloma and Bone Cancer Research in West Hollywood. Now, before we talk about ARROW, we actually need to go back to Champion, and you headed up that trial. Tell us about Champion.
Yes, that was a single-arm trial in which patients in a phase 1 received escalating doses in number of cohorts, ending up at 88 milligrams per meter squared once a week after a test dose at 20 milligrams per meter squared on day 1. And when we got to the top dose, 88, we had some toxicity, so we backed off to 70, and then we did more than 100 patients at that dose, giving the drug once a week on days 1, 8, and 15, rather than on the approved schedule, which was 2 consecutive days on 3 consecutive weeks. And the results were very promising. The responses were great. The progression-free survival was excellent, and tolerability was well at the 70 milligram dose. So that provided the basis for the randomized trial, the ARROW study.
That's what you're presenting here. Now, I mean, yeah, 1, 8, and 15 would certainly be better than having to come in on days 1 and 2, 8 and 9, 15 and 16. It's got to be more popular with patients if it works. So the question is, does it work?
Yeah, I mean, the astonishing part of it, although we got a hint of that in the first study, that although the preclinical data and other animal models using a number of different types of cancer, it suggested that 2 days in a row was better than once a week. Believe it or not, it was actually better giving it once a week than it was twice a week. It was more active, it had a better response rate, it had a much longer progression-free survival, and yet the tolerability was just as good as 2 consecutive days.
And despite more intensive therapy with a once-a-week regimen, the incidence of adverse effects really wasn't much different.
No, so the important events we care about are high blood pressure and heart-related events, and there's really no significant difference between the arms whatsoever.
I mean, with significantly improved PFS and overall response rate versus twice weekly, why? I mean, it sounds like it's too good to be true. I mean, do you have a theory as to what the mechanism is or why you ended up finding what you found?
Well, the mechanism through which it's better once a week is completely not understood, because actually in the preclinical model it was suggested that it would be better to give this drug more continuously. So we don't really have a clue. It certainly suggests that the maximum concentration, getting it higher with that one push rather than 2 consecutive days where you don't get as high, what we call the C-max, will be more important in determining whether the drug's effective. But at the same time, there was a thought it would be associated with more toxicity. Yeah. So what's perplexing is we got the increased effectiveness, and yet we didn't see less tolerability.
So what's the take-home message between Champion and now ARROW?
The Champion trial and the ARROW trial teaches me, which I've been doing for a number of years, to give the drug once a week. So we in our clinic never give this drug twice a week, even though that's off-label and we still don't have the FDA approval quite yet, but we've been encouraged enough by the trial we did several years ago and published that that's the way we've been doing it, except for within clinical trials that require twice a week dosing. So in our regular clinic placements, not on clinical trials, patients get it once a week.
So is there going to be an attempt to ask the FDA for a change in the indication?
Yes, there'll be an attempt to get an approval on the once-a-week dosing.
Congratulations, because this is something that you wouldn't necessarily have seen going in, but it's really good you've done the trial.
Yep, it's been great news, and especially for patients trying to drive around in Los Angeles traffic. They love it.